Hello everyone, it's Karen Furlong and welcome to the webinar this afternoon. It's about 1 minute after 1, so Lynn and I would like to get started. So Lynn, I don't know if you want to say hello.
Hi everybody, welcome to this webinar. Nice to see so many of you on the line. And Karen and I are going to go through our content this afternoon with some time for discussion after, and hopefully we can have some good discussion. And if you have any questions along the way, please don't hesitate, put your hand up, and we'll keep an eye on the board here. So I'm currently based at the University of Toronto, but I happen to be in New Brunswick today, so Karen and I are here together.
So welcome everyone. For those of you that don't know me, as Lynn has said, I'm here at the University of New Brunswick in St. John and teach in the Department of Nursing and Health Sciences in the undergraduate nursing program. And have an interest in informatics for some time now, and my PhD work was based in education and training for nurses who are learning to work with electronic health records. So we'll move to the first slide, which is some objectives for today. And when Lynn and I met to get ready for today's presentation, we talked about the competency-based discussions that we've been having along the way with Kazan and our work with the peer leaders across Canada, and we'll talk a little bit about that as we go. The objectives for today are to look at the entry-level competencies for informatics, and that is work that Lynn's had a lead role on, and those informatics competencies were released by Kazan in 2012. So some discussion initially about those, and then Lynn will speak to the second objective, which is to learn a little bit more about the movement towards the adoption of standardized terminology. And really, I had said to Lynn recently about I feel that we are changing in how we talk about the adoption of standardized terminologies, and that years ago we were talking about it as a possibility, and now we are in a situation that we know this is happening, and as educators positioning ourselves so we have a better understanding of what nursing terminologies are about and the need for them so we can help to prepare future nurses. And finally, looking at some strategies for nurse educators, and that has been a big part of what we've been doing recently within the network, the peer leader network, with a group of nurse educators across Canada who have been helping educators to understand the informatics competencies and to develop some tools to support the integration of the competencies within curricula, nursing curricula across Canada. I do want to point out, too, that the work that we have been doing in recent years is a partnership with Canada Health Infoway, so we've received some funding to be able to take on these initiatives and to develop some of the key outcomes as far as some of the tools that have been developed recently. One of them that we will mention and even provide links for you during the latter part of the presentation is consumer health solutions and some teaching tools there. Obviously, the focus today is on digital standardized language and digital health. So looking at the definition of digital health, there are different definitions. It is a term that's being used now to encompass information communication technologies. And really what, in speaking to this, I always like to emphasize that it's not just about the computer, that it's about people and processes. And this is one of the definitions that we tend to use in our discussions within the peer leader network, because it does get beyond the focus of a computer and talks about the process of learning to understand, to access, and use information. Now, the position statement is the next slide, and that was recently released in May of this year. And one of the key things that we're pointing out here within the position statement is the nursing informatics competencies, and really to acknowledge and realize as educators that what we're talking about here is really not a specialization, which, there is a continuum there as far as the basics versus being specialized in informatics, but the core competencies for nursing competence is inclusive of informatics competencies. And that's what we've been speaking to and attempting to help educators within our work in the Peer Leader Network. So this is the document that I've made reference to now a few times, the Nursing Informatics Entry-Level Competency document that was released by CASN in 2012. There is a link there, and I believe all participants will have access to the slides. So those of you, and perhaps we can speak or talk a little bit more detail about the competencies for those that are just becoming familiar with them at the end when we have, I think we've allotted for a good 20 minutes for some discussion at the end. So this is the overarching competency within the work that was done by the task force. Lynn, I think that work started back in 2009, 2010, thereabouts. It was a couple years of work with nurse educators came together, and the outcome being these basic nursing informatics competencies. So this is the overarching one, and again, talking with educators and helping us, and those of us that are called to prepare future nurses about information synthesis and information literacy, and again, pushing that it's not just about computer literacy. So the foundational basic computer literacy skills, the expectation is that students that are entering our programs do have these skills, and again, there is a continuum there. Sometimes there is a need for additional learning for our students, but the norm and the expectation is that students, for the most part, do have these foundational skills. So the focus of the entry-level competencies within this document are those 3 competencies that are listed here. And what we've done today is actually look at what competencies are linked to data standards, and helping those of you that are on the call to appreciate work and learning experiences that potentially could help students to develop competencies in these areas. So the first competency, information and knowledge management, and there's 4 indicators that we've looked at and pulled forward from the document, and again, these indicators that are listed here, there's 2 on this slide and 2 on the next slide, are not all inclusive for this one competency, but these are the ones that are linked to the standardized nursing and clinical terminologies and learning the basics of the importance in adopting standardized terminologies within the electronic health records. So the ability to analyze and interpret data that we are gathering from these various systems. Lynn's going to speak about and give an example on the importance of having standardized language and the ability to share data across continuums, and then to be able to use data to support quality care and evidence-informed practice. I guess it's practice-informed evidence. So the other 2 indicators from this first competency then, as far as developing awareness of the need for standardized nursing data, and again, having opportunities for our students to learn about the importance of standardized nursing data, and some of the examples that we can be integrating within some of, not just classroom, but laboratory and clinical practice experiences. And that higher level of analysis really, as far as the accessing and critically evaluating both data and information, is a piece of those basic informatics competencies. So the second competency is professional and regulatory accountability, and again, there are a number of indicators listed within the competency document. This is one of them that we've pulled out to link to standardized terminologies. In compliance, I guess, would be the key word here as far as using documentation tools as they are intended. And I guess in order to be able to do that, there needs to be a level of understanding by users, this case being our students who are learning how to use the various clinical information systems and the modules that are within those systems. So the final competency, information and communication technologies. And again, students learning about the various modules within the electronic health records. Most systems across Canada do include clinical documentation and medication administration platforms. So helping our students to learn how standardized terminologies within clinical documentation, as an example, would be helpful in the ability to share information across settings and being able to use the data to extract that data for research. So these are all necessary discussions that we need to be having with our students. So I believe Lynn's going to take over from here and have a discussion about various standards and some examples as far as things that we can be doing with our students in the various settings as far as clinical, lab, and classroom settings. So Lynn?
Great, thanks, Karen. So I'm just going to pick up on, give you a little bit of context about some of the other things that are going on in the country right now, particularly as it relates to the adoption of clinical data standards. And when we talk about data standards, we're talking about the use of standardized language in nursing practice to describe nursing practice. And I'm going to give you an example in a few minutes as to how that actually translates when we start looking at having the capability to codify nursing practice and the outcomes of nursing practice through the input of clinical documentation into electronic health records. So there's been, over the last couple of years, 2 national symposia which have included nurse leaders and educators, policymakers, executives, and some key stakeholder groups, where we've actually brought individuals together to talk about how do we actually get to some commonality in how we describe and capture nursing practice across this country. And of course, we can't do that in isolation of you as educators, because you need to be part of that dialogue as you are the ones preparing students to work in these now computerized healthcare environments. So the implications for curricula are important as you think about how you teach clinical documentation. So the emphasis of today's session is really about how does all this fit in the context of teaching clinical documentation, both in your labs as well as in the practice setting. And there's no question that we're well aware of the fact that there is variability across practice settings, but there's also a lot of variability across schools of nursing in terms of how you teach clinical documentation. So hopefully with the adoption of some standards, we can bring some consistency to that approach. And why does it matter? I guess, you know, for many, many years, we've been documenting nursing care, and by and large, those nursing documents probably never actually get retrieved unless somebody's doing a study and is looking for specific elements of data, through which the process is very onerous, as you can imagine. Any of you who are researchers, having to do chart audits makes the process of gathering consistent data for comparative purposes a rather difficult and tedious process. And you know, I always harken back to Nightingale. Those of you who've heard me speak before, you know that I take a lot of lessons from her playbook, because I think she had it right. And for as much as we've been implementing electronic records over the last 30 years, we still have work to do. And so when it comes to nursing and being able to actually do some comparison of nursing practice and the impact of nursing practice across the country, we're challenged because we don't describe our practice consistently and we don't capture clinical outcomes in a consistent way. So in as much as in 1863, Nightingale was struggling to find comparative records to actually look at causation of disease and what made a difference or not, we are still challenged in that regard in terms of nursing practice. And so comparative capability is limited. And, you know, this quote goes back a number of decades as well. And Norma Lang and Clark actually wrote this article back in the early 90s. And I would say this is still very apropos today. Again, this is a quote I use many, many times, because if we can't be clear about what it is that we do as nurses, then these elements become almost impossible. So I want you to hearken back to this again and again as you think about why this matters, because it becomes very difficult to describe what it is that nurses do that's unique and different, that makes a difference in the outcomes of Canadians. So we've got a whole bunch of elements here that justify the rationale for this work. And I think making nursing visible is a really important one. And any of you who have any familiarity with the Canadian Institute for Health Information, you'll know that most of the nursing data that's housed there today is specifically in relation to the human resource mix and numbers and location of nurses, but we don't have a lot of information about the impact of nursing practice. We certainly have things like diagnosis and physician information, but we don't have a lot about nursing. And we've got a very exciting initiative underway right now, which I'll talk to you about in a second. So the accountability, being consistent in how we document care and being accountable for that. There's no question that if we had consistent ways of capturing practice across care settings, we'd be able to look at things much more easily in terms of continuity of care, continuity of information. And the area that, you know, is probably resonating most with those of us who are educators is we want to make sure that there's a continued alignment between practice and education. So if students are now being exposed to these clinical documentation standards, you want to make sure that you're actually teaching those as well at the front end. And as we talk about practice-based research, having the ability to actually generate new nursing knowledge on the fly by virtue of using electronic health records, to me is the most exciting frontier for us in the face of having some standardized data. And being able to look at that relative to things like nurse-patient ratios and staff mix, in which those of you who work in institutions know that we are continually and incessantly challenged to dilute our professional staff mix. So always keeping this front of mind as another important element as we look at trying to influence health policy and directions for things like staffing and where care happens. So with all of those rationales in the back of your mind, I mean, if you think about it, if we had the capability to actually look at an individual's data and have the capability to aggregate that, either on the basis of diagnosis or the types of care that's being delivered, where care is being delivered and by whom, if we could aggregate that, then being able to look at the impact within an organization or within a sector of care, you know, be that within acute care, long-term care, home care, we can start to understand how we're using our resources and where they're making healthcare improvements or not. Are we getting value for money? And then we start to roll that up either at the regional or in the Ontario case, the LHIN level, you start to get a different capability for looking at allocation of resources at a regional level and actually creating more of a capability to look at how the system is performing. And then imagine nationally, and this is where we're incredibly challenged because we don't have a national data set that tells us about what nursing practice elements make a difference and how. So that's kind of a synthesis of why this is important. And so I've talked about a lot of this, and what we talk about is we're doing this national initiative is really about data collected once for use many, many times. And if everybody documents things in different ways, we can never get to a peer group comparability perspective. We wouldn't, in the same vein as we are increasingly engaging consumers in their own care, the more we talk about things the same way and use the same terminology and measure them the same way, a lot easier it is for citizens and their families to understand what it is we're talking about. So if you just think something as simple as a pain scale or risk of falls or somebody's functional status, if we measure those in consistent ways, people come to understand from their perspective how that's important to them without having to kind of rethink every time they're in a different sector, what do they mean by that? And data standards right now, Karen mentioned the CNA, CNIA position statement which came out this year. There's a lot of language in that. I encourage you to look at it. There's a lot of language in there around data standards. And right now in nursing, there's much discussion both in Canada, and certainly our U.S. counterparts have got about 3 or 4 years on us in terms of this type of work. But there are some very common core elements that we're focused on. The International Classification of Nursing Practice, the observational panel that's created by LOINC, which is basically head-to-toe assessments, CHOBIC, which some of you will be familiar with, which is the Canadian Health Outcomes for Better Information and Care, and the inter-RIDE tools, which are in use across many settings in this country, home care, mental health, and long-term care in particular. And then we have these things called reference terminologies. So what this all goes towards is having some capability to extract data in a consistent way from our electronic health records. And one of the outcomes of the symposium that we had nationally last year was a resolution that went to the CNA board. It was at the biennium last June, didn't get to the table, so it was passed by the board in November. And you can see that specifically the CNA has endorsed the adoption of the International Classification of Nursing Practice and SNOMED CT, which is a sort of a behind-the-scenes coding system, which I'm going to give you a very simple example of in a minute. And so CNA is basically saying we believe that a standardized approach to nursing documentation in all practice settings is important. And so also referring to specifically CHOBIC and the Nursing Physiological Assessment Panel. There's lots of background to this resolution if you're interested. If you go to the CNA website, there's a full document there with the rationale. So CHOBIC, which has been implemented fairly widely in Ontario, also in some sectors in Saskatchewan and Manitoba, is now getting greater uptake in other jurisdictions. I know that Peggy White, my colleague in this work, who's been very much leading it with Dr. Catherine Hanna, they are in discussions with PEI, Alberta, and BC at the moment. And so we are continuing to see an expansion of the adoption of these outcomes across the country. And they're a very small suite of measures, but they're consistently defined. They're based on nursing evidence. That's how we originally identified them. So these are evidence-based where tools are already gathering some of this data, like the InterRI. We simply adopted the tools already in place rather than asking nurses to do duplicate documentation. But you know, historically we haven't had a consistent tool for measuring fatigue or dyspnea or nausea. And certainly the falls risk and pressure ulcer risk, commonplace in many organizations, not always consistent. Therapeutic self-care is something that we have never done consistently in nursing, and that is essentially, the other term for that is readiness for discharge. So do people know what they need to do when they go home? Do they know what their meds are? Do they know who to call if they get into trouble? And are they in fact ready to be sent home? Or if they're not going home, are they aware of what that follow-up care is going to be? And so over the course of the last decade, we've actually seen these measures being consistently captured in all of these sectors. I'll give you an example now of codifying the data. So we know that we have people with chronic obstructive lung disease that could be called, in many instances, different terms. So we have COPD, COLD, chronic obstructive airflow. And when it comes to SNOMED CT, the code for that is actually the number that you see up in that top box. So it doesn't matter the terminology, it actually gets codified the same, because now, with some exceptions, and then there are other modifiers that get applied to the diagnosis, but this essentially gives you a common code for all of these diagnoses. So if we take a patient who has this diagnosis, I don't know if you can see my mouse or not, this person also has had an assessment done of their ADLs, their dyspnea, their fatigue level, and for therapeutic self-care, their ability to manage meds. And if you took all of those scales, and each one of these would have a numeric representation that is then codified, we would then be able to do an analysis of how many people COPD or COLD are ambulatory. What is the overall dyspnea level for people at a certain stage of their disease? Are these people able to manage on their own? Are they able to go home at discharge? So if you take all of that data and you codify it based on documentation, so it all comes back to the documentation. So in our historic way of saying, well, he's a little bit short of breath, or he's a little tired today, but not as bad as yesterday, it becomes very subjective. But as we start to codify this relative to the patient's perception, then that changes things dramatically. And then if you take all that data and you assemble it, basically, for this individual, that becomes part and parcel of representing who they are in terms of their current state. That data goes in a consistent way to all these various recipients. And so if we're all talking the same language and we're all looking at the same type of data, imagine the difference that that can make for both care as well as the recipients of care. And so, to my earlier point, you know, I think historically we haven't been as definitive in some of our documentation. And so that inconsistency really doesn't do anything to aid in increasing clarity and continuity of information. And so we could never codify data, at least with the tools we have available to us today. We can't codify a lot of nursing data without some of these discrete measurement tools. And so, and this slide looks a little off, but essentially what we're talking about is another type of standard. So we have lots of standards that we encounter. You probably don't teach a lot about interoperability standards, and for all intents and purposes, all you really need to know is that using common terminology and common coding allows information to be shared easily. Quality standards and practice standards and requisite organizational practices are familiar to all of you. But without clinical data standards, we can't really impact the type of directions that we want to see happen, both in practice, how we actually are able to manage healthcare organizations, how we conduct research, and how we can ultimately influence policy. And so for CAUSN, we've raised this as a very key area, and as you'll see from Karen's comments about the competencies, they are very core to teaching nurses how to document and, aligning your clinical documentation teaching with the types of standardized languages that are starting to be embedded in clinical systems across the country. So what we want to help you think about is what are some of the things that you can do to help your students to really understand how to use standardized clinical data. And so one of the things that we did, and I'm not going to play this for you, but we'll leave the link with you, CAUSN and Infoway supported us to develop this little whiteboard animation, which makes the case for why it's important. And I would encourage you to use this as a teaching tool. It's one of a couple that we have available for you to use with your students. So I think from here, Karen, you're going to pick up again, so I'm going to turn this over to you.
Sure. Thanks, Lynn. All right, so just the last few minutes, Lynn and I wanted to share with you some additional resources that perhaps we can talk about in a little more detail during the 20 minutes that we've allotted for some questions at the end and some discussion with you. So one of the additional resources that takes us away from, I guess, the focus of our discussion today, which is on clinical documentation, but it does get at the essence of professional accountability within the use of information and communication technologies. So this particular whiteboard animation was developed. It was one of our first outcomes from the first phase of the peer faculty resource work that we've done, in that it's helping students to appreciate both the benefits and risks of social media use. So it's in two parts, and we do have an activity that goes along with it, and the link is there for you as far as going out to the CASM website and having access to both the whiteboard animation and the activity that would be inclusive of some learning objectives that are linked back to the CAS and entry-level informatics competencies. It certainly has been well received. I've used it myself a few times in the classroom with students, and just getting them to think about differences in how they're using social media as a professional versus social media in their personal lives. So lots of helpful, necessary discussion has evolved from the use of this particular whiteboard animation. And just the animation that Lynn just made reference to as well, the one that has been most recently developed on the standardization, it has a similar approach in that it's intended to provide students or encourage students to have these necessary discussions. Most often within the classroom setting, these tools are being used. But again, that the standardization, that documentation, or the standardization video that we did, the whiteboard animation, there is an exercise that goes along with that too that Lynn and I developed. I think that was last June. We did a workshop with AR CAUSN. So some additional resources on this slide. The Nursing Informatics Toolkit that has been available for a little while. I think that was in around 2013, but again, that's available on the website, and some things are listed there that you would find within the toolkit. Would include PowerPoints for in-class discussion and some exercises that you could do. Some of you may have some questions about some of these resources that we have on these slides, and we can definitely talk about them in more detail during the final 20 minutes of today's webinar. Lynn had made a point about us as educators creating opportunities for our students to learn about clinical documentation and the value and the need for it. One of the things that we've talked about is teaching clinical documentation within simulation and in the laboratory setting, and that is something that is happening in various programs across Canada, and perhaps something we can talk about in more detail in a few minutes. So this is the link to the toolkit, and it's actually fairly lengthy. I think it's around 100 pages in length. So I know most educators are not downloading it. They have a tendency just to go out and use it as they need to. But it's certainly been helpful, and we've received a lot of positive feedback from educators across Canada who have used it. So a few additional resources. Many of these Lynn has mentioned in her portion of the webinar today. The work that's been done with CNA, with the CINIA Joint Position Statement on Nursing Informatics, and some of the comments that were made today are coming directly from that statement. It's interesting, I know I was out there recently looking at that joint position statement with the earlier position statement and the changes, and that in itself would be an interesting activity to do with students in the classroom. And the work that's been done by the Technology Informatics Guiding Educational Reform, or what we've often we hear the acronym TIGER, has certainly been very helpful to educators here in Canada. Again, a couple more links, and these are in reference to some of the terminologies that Lynn made reference to within her discussion today. Lynn?
I'll just add something here. For those of you who are interested in seeing more specific information about CHOBIC, if you go to the website, there's a number of resources there, and including articles that have been written about the experience, the evaluation of the use of CHOBIC, some sort of hands-on direct resources for potentially using with your students. So I encourage you to have a look at that. ICNP is a much bigger entity than sort of what we've embarked upon at this point, but there's no question that that is the overall context of what we're adopting here in Canada. So important to have that connection.
You should finish the last slide there.
And so, you know, again, I come back to Nightingale, and we're starting small here in the country. We've got a lot of work to do, but I think if we can get this initial phase right, and if we can get you as educators aligned with the work that we're trying to advance in the practice settings, I think we'll achieve a lot together. Our working groups from the symposia include an education group, so we welcome anybody who has an interest in this space. That group is going to be, it's being chaired by Margaret Kennedy, who's known to some of you, and Margie's based in Nova Scotia, but the education work will continue to be unfolding with Cousins support, but also independent of Cousins support. So there's a lot of effort that will be underway, and we'd like to encourage you to join us if you want. Seeing a couple of questions here. Copy of the slides, yeah, so those will be available. So this is your time to ask us questions. It's always a challenge to present a lot of very deep content in a very short time at a very high level. So if anybody has any questions, we'd be quite open to opening up the floor now. And if you're not all educators, I must say there's certainly a place for all of this work as educators, either in clinical settings, but also as individuals who work in practice settings primarily. We have working groups in administration, clinical practice, policy, education, and research. So some of you may be primarily focused in your own program of research. We have a group that's been formed to actually focus on the type of research that needs to be done in this space as well. You're a quiet group. No questions? Anything else you want to add?
No, I was just interested in knowing, as Karen speaking, if there's any examples of using some of these resources currently in, like Glenn has said, perhaps those of you that are teaching in undergraduate nursing programs, or perhaps you working in clinical settings where you have lead roles with clinical documentation, or if or even perhaps your input on how you potentially could see these tools being effective or helpful to you.
There is a question here. On a continuum, where is Canada in regards to clinical documentation and standardized documentation? I think it's early days would be my summary of that. Most of the early adopters have been organizations who have been just in the process of adopting clinical documentation online. We're also seeing a lot of organizations who implemented electronic health records 1 or 2 decades ago, who are now in the process of upgrading or replacing their systems. So that's where we're looking at the opportunity to leverage the integration of standards. Most organizations who implemented clinical documentation online years ago simply took their paper chart and replicated it online. And of course, as you can imagine, replicating a process that may not be particularly helpful on paper is not going to be any more helpful online. So it's a real opportunity. Here's a question. I'm working with EHR implementation in BC. What additional education would you recommend for our informatics team? I would suggest that your informatics team should be familiar with the entry to practice competencies. We've certainly seen other disciplines take advantage of this, so it's not just about nursing. I think you could take that document and really repurpose it for other disciplines, particularly if you're looking at interprofessional documentation. We also found that people using the toolkit can actually use those exercises that have been designed for students, can also use them with staff. And I think familiarizing your team with those various core standards that we've identified today, there's certainly lots of people who are quite willing to help you, and I would encourage you, if you are interested in talking to Peggy or myself on the area of standards, always happy to connect with you. We spend a lot of time speaking with informatics teams in different parts of the country.
If I could just add to that, Lynn, in the need for the education as well as the training when there's the integration, when you're in times of transition. So my experience is when I left my position here at UNB and worked on the project in this health region was that we were spending the time on training as far as helping nurses and healthcare providers at the bedside to prepare for the go live date. The emphasis was on the use and the training and how to use the system, and really the users were not aware of the reasons for the adoption of the new clinical information system. So gradually, months into this time of transition, those of us that were in lead roles to assist healthcare professionals in getting ready for integration, we realized that there was that big piece that was missing, that users really were not aware of and didn't understand the reasons for adopting this new system. And I do believe that that holds true for a lot of the discussion that we're having today, in that understanding, and Lynn, you spoke so well to the value and need for standardization of terminology. So I believe that that's true in that context as well, and that we need to be having these necessary discussions, making them relevant, and to help nurses, both practicing nurses and future nurses, appreciate the need for standardized terminology. And I do believe that we are having more and more of these discussions, and we are in a point now that we do realize that this is coming, and in many places it is gradually. I know you're saying that we're in an infancy, kind of just getting started, but we are definitely heading in that direction. And the need for it is certainly more visible and being discussed about more often in clinical practice.
Yeah, and Eileen, thank you for your comment. She says we also need to lobby, so when clinical systems are implemented, they need to make them readily available to our schools of nursing. This is always a bit of an interesting discussion point. Not all vendors are prepared to afford you access for students to the clinical system. Some schools and some vendors have been able to forge great partnerships. But I have to say, when you live in the type of community I live in Toronto, where there are 10 different clinical information systems on 6 city blocks, it doesn't actually help to teach them one system. And so I would actually implore you, you know, unless you are in a community where your grads all stay with you, to think about this in a broader conceptual way, that it's about teaching the students the concepts that are composite in clinical documentation tools, and not necessarily learning an Allscripts or a Meditech or a Cerner system. And I think, you know, where you have the opportunity, and I know, Eileen, where you are, it's great, and your students are probably doing their clinical in common sites, but where we have students going to multiple facilities with multiple documentation systems, it's always a challenge. Question here, is anybody from Quebec involved in these committees? Yes. And if we'd like to be involved, how do we proceed? Chantal, just get in touch with myself. I don't know if we gave our emails here at the end, but we can certainly, through cause, and you can get in touch with us. We do have some people from the University of Sherbrooke in particular, and I know Dr. Sylvia Jette was involved in our competency development work and has helped with some of the translation of our documents. So I think the only other thing I wanted to add is that, you know, there's enough work to go around. There's different ways we can tackle this, but I think our opportunity is ripe right now. One of the things that's happening that I didn't mention is that we have a pilot study underway right now where we're actually abstracting some of the CHOBIC data into CIHI's discharge abstract database. So from 2 organizations, one in Manitoba and one in Ontario, we're actually putting nursing data as part of the discharge abstract database. And that's the first time nursing data is actually appearing in that repository. So that's pretty exciting for us. The only other thing I want to add is that in terms of new initiatives, look at your organizations that you're partnering with. Get yourselves involved if you are interested at all in this work. And I know some schools have actually adopted some of the online learning resources from companies like Elsevier and their eChart and so forth, but I'm not sure that those tools are necessarily going to cut it for what we're talking about today. We have a couple of minutes left. I don't know if there's anything else. Janet has put an email up here for anyone wanting more information or to get involved with COSN itself. Any other questions? Somebody's typing.
I see Michelle is typing. We'll just wait.
Okay.
Oh, thank you for Michelle as well. Okay, if there are no other questions, I would like to formally thank Lynn and Karen for an excellent presentation. I think the discussion was key. We have the links to the resources, but the discussion was so encouraging. And even the word lobby was used. I was going to say advocate, but Lynn used the word lobby. And I think that with the caliber of people we have as participants on the line today, that there's lots that we can do as a group to effectively move this agenda forward on clinical documentation. And I'm really excited to hear about the pilot study, Lynn, and for those of you who want more information, please feel free to contact the facilitators directly or contact me and I can get you in touch with the facilitators, Karen and Lynn. So thank you everybody for participating, and I'm glad that somebody learned something already. Is there an evaluation for me? Okay, no evaluation, but please send in your comments to me and I will summarize them for Infoway. Thank you as well for Infoway. We have one participant today from Infoway, and we really appreciate the funding opportunity, and we are continuing to work with Infoway in the future, so we're very excited about that as well. Thanks, everyone.
Thank you.
Okay, bye-bye.
Bye-bye.